Good morning. Welcome in here to Live Now from Fox. My name is Christy Matino. Thank you so much for being here with us. We do start off with some breaking news. Effective today, the United States has officially left the World Health Organization. Here's what we know. The U.S. finalized its withdrawal 1 year after President Donald Trump announced America was ending its 78-year-old commitment. I do want to share this post here with you. This is from the White House this morning, and it says, effective today, the United States has exited the World Health Organization. This fulfills President Trump's commitment under an executive order signed 1 year ago following the WHO's mishandling of COVID-19 and its ongoing lack of reform, accountability, and transparency. However, according to the World Health Organization, the U.S. owes more than $130 million to the Global Health Agency. And Trump administration officials acknowledge that they haven't finished working out some issues, such as lost access to data from other countries that could give America an early warning of a new pandemic. The U.S. is legally required to give notice 1 year in advance of withdrawal, which it did, but also to pay any outstanding financial obligations. The World Health Organization saying the U.S. has not paid any of its dues for 2024 and 2025. An administration official denied that requirement Thursday, saying the U.S. had no obligation to pay prior to withdrawing as a member. The organization is the United Nations Specialized Health Agency and is mandated to coordinate the response to global health threats such as outbreaks of Mpox, Ebola, and polio. It also provides technical assistance to poorer countries, helps distribute scarce vaccines, supplies, and treatments, and sets guidelines for hundreds of health conditions, including mental health and cancer. Nearly every country in the world is a member. On average, the U.S. pays $111 million a year in member dues to the World Health Organization and roughly $570 million more in annual voluntary contributions. Now, that's according to the U.S. Department of Health and Human Services. In an executive order issued right after taking office, President Trump said the U.S. was withdrawing from the World Health Organization due to the organization's mishandling of the COVID-19 pandemic and other global health crises. He also cited the agency's failure to adopt urgently needed reforms and its inability to demonstrate independence from the inappropriate political influence of World Health Organization member states. That's a quote there from the Trump administration. Now, another Trump administration complaint is that none of the World Health Organization's chief executives, there have been 9 since the organization was created in 1948, have been Americans. Administration officials view that as unfair given how much the World Health Organization relies on U.S. financial contributions and on U.S. Centers for Disease Control and Prevention personnel. The U.S. has ceased official participation in World Health Organization-sponsored committees, leadership bodies, governance structures, and technical working groups. And that would seem to include the World Health Organization group that assesses what flu strains are circulating and makes critical decisions about updating flu shots. It also signals the U.S. is no longer participating in global flu information sharing that guides vaccine decisions. Trump administration officials say they already have public health relationships with many countries and are working to ensure direct sharing of that kind of information rather than having World Health Organization serve as a middleman. But U.S. officials did not give specifics about how such arrangements are in place.